Um, like I used to think the FBI was after me or whatever, and I know that's a lot of cases in the first onset, especially, or a lot of people that have psychotic disorders.
Hmm.
Um, so that just something I want to mention. So then you talked about you had something else. Did you have another diagnosis, or was that OCD, PTSD, anxiety,
And depression.
depression? So have you ever had to think about anything else other than meds?
What do you mean exactly? I'm sorry, I don't understand your question.
Like alternative um, things like ketamine, um, the
I mean, I have not done anything like that or etc or anything like that. I am willing to admit that occasionally, to cope with a tough day, that it's not unknown for me to have a glass of wine or a beer or marijuana. Now I realize that that's not the healthiest coping mechanism, but it's not a habit. It's not something that I do often, but I do occasionally partake in those things as a form of comfort. And honestly, it typically usually does calm me down a little bit and help me sleep. But that's just me.
um, okay. Let's talk about a little bit about how meds are important for you to take, and how important are they for you to take?
So my main medication is Effexor, and it was given to me shortly after my daughter passed away 6 years ago. At the time, I was not taking any medication at all, and Effexor was prescribed to me primarily because it's a very quick acting drug. And as a matter of fact, it's one of the quickest on the market. Oftentimes, when you take other types of antidepressants or anti-anxiety medication, it can be weeks, if not months, before they really start working. You can start taking Effexor and it be working very quickly. And so I was in a real state of shock and horror at the time. And I was prescribed Effexor at a very high dosage, which I have off and on come down on and back up on and down on and back up on. And I am just really not been successful at coming down on my dosage at all in the last 6 years. And I've just learned to be okay with that. And not, there are side effects, but for me, not taking my antidepressant means that I have thoughts of self-harm, and I have repeated thoughts of self-loathing. And when I do take my medication, I very rarely have those thoughts. So it's absolutely imperative that I stay on that medication. I have no hopes and no aspirations to ever get off of it. I'm fine with that. Um, Also, for me, when I somehow accidentally forget to take it, I go into withdrawal very quickly. I get nauseous, and the room starts spinning, and I feel off balance, and I feel like I'm going to throw up. So the withdrawal symptoms usually come in like within 24 hours, and usually I figure out what's wrong and immediately take my medication. I 99.9% of the time am very good about remembering to take my medication, but on the rare occasions that I don't, my body is telling me that it needs it immediately. So I've kind of just accepted that that medication is going to be a part of my life, probably forever. And if that's what I need to avoid having those thoughts of self harm or self-loathing, then I'm fine with that.
I have to take all my meds, which is about, I want to say like 8 or 10. About half of them are for my moods. And so if I don't take any, or if I don't take all of them, the most important one is probably Seroquel and Caplyta, which one's an anti, well, it does two things. It helps me sleep, the Seroquel, and it helps me, it's an antipsychotic, obviously. The Caplyta is an antipsychotic, and at the same time helps me with bipolar. So the hope would be, and I'm on one other antipsychotic, I don't know the name, but the hope would be for me to get off the Seroquel at some point, or get lower, and then rely on the Caplyta more. That point in my life, I'm not at that point, but that would be a goal.
Yeah, every time I've tried to back down on the dosage of my Effexor, it's backfired, and I've started having those thoughts of self-harm and self-loathing, and I've honestly just kind of given up. I've just sort of accepted the fact that I need to be at the dosage that I'm at, and I don't think that it's a bad or a good thing. It just is what it is, and that's what I need to be on, and I'm really okay with that. But I hope that you reach your goals that you're looking for. I mean, there are side that I wish that would be lesser. If I were on a lower dose, I wouldn't have the side effects that the medication has, but it's worth it to me to cope with the side effects than feel like I want to hurt myself all the time.
I'm on different. I've been on 500 Seroquel, so that's my hope to go down this month, maybe 600. They're not that different, but it might help me with some of the side effects.
One of the exciting things about practicing psychiatry today is that we have so many tools available to help our patients. When it comes to treating illnesses like depression and bipolar disorder, medications are often the tools we turn to first to help relieve patients' symptoms. So how do psychiatric medicines work? In general terms, they impact circuits in the brain by affecting chemicals called neurotransmitters. Neurotransmitters work the on-off switches in the brain that influence thoughts, emotions, behaviors, and key functions like sleep and appetite. When someone is having symptoms of depression, it's a signal that the brain's normal activity has been upset. Today's wide range of psychiatric medications each work in slightly different ways to help restore that balance. Psychiatric meds fall into 3 categories based on the specific problems they're designed to address. Antidepressants help lessen the symptoms of depression. Mood stabilizers reduce the frequency and severity of episodes of depression or mania associated with bipolar disorder. Antipsychotics are used to counter some of the more intense symptoms of psychiatric illnesses like hallucinations or severe anxiety. Although these 3 classes of medications serve very different purposes, when it comes to making them part of a patient's treatment plan, they actually have a lot in common. Different people react differently to each type of medication. So it's often unclear which will be the best fit without prescribing it and trying it. It can often take weeks or even months to judge whether a medicine is working. Often, a switch in meds is called for. Even if one works for a time, patients may need a change in their prescription or the dose that they take at some point. Finally, psychiatric medications have been shown to work best when combined with psychotherapy or talk therapy, where trained counselors help patients tackle life challenges and develop better problem-solving and coping skills. What does all of this mean for you? As a patient, it means that filling your prescription is just the beginning. It means sticking with the medication long enough to find out if it works and never changing the dose or stopping a medication on your own without first talking with your doctor. It means being willing to try more than one medication or maybe a combination of medications over time. It means listening to your body and sharing your concerns about symptoms and side effects with your doctor. And it means being open to trying psychotherapy along with meds. In short, to give medication the best possible chance to work, you have to work too by teaming with your healthcare provider and actively participating in your own treatment and wellness.